the two Katies are very excited to get to work with you, today. We're going to tell you a little bit about Inroads. We're also going to tell you a little bit about how we see abortion stigma manifesting in the world, the way that can turn into negative health outcomes, the way that can turn into discrimination, the way that can turn into oppression, and often at the result of intersecting stigmas, oppression, and sometimes, unfortunately, serious health complications and death. So but we're going to get into the specifics of that after we all ourselves look at the way that abortion stigma and ideas are created. So what I'm going to ask you to do is take Katie's handing out paper, which was, we are lucky enough to have, it's not worse. No. While you're getting this,
I have to click back on the PowerPoint.
I'm going to have to touch it. Just touch it. There we go. All right, so we are going to discuss, there's a lot of barriers to good healthcare and access, and sometimes it is just the clicker. So what we're going to talk about today is and we're going to ask you to all participate, so get a couple pens. It's good to have at least 2 colors. If you need a couple more colors, we can bring them back up. So I'm going to ask you to put down your delicious sandwiches for 1 moment, and there will be time to pick them back up, I promise. And what I'm going to ask you to do today is think about the pathway, we call this a lifeline sometimes, so write the line, the trajectory that your life has taken and is taking. So so sometimes people like to do like a snail shell curly Q. Maybe it started really high and there were some dips. Give yourself an idea of what, so here's, there's one big dip and it's gone up. Sometimes people like to do a nice shot straight through the ceiling. Take a second and draw where you feel like your life has been. Just your life story. Look at think back to your birth and draw the line that takes you to today and to the future.
However it feels today.
Whatever it feels like today.
It's making me feel very vulnerable right now.
Like if I don't know high or low?
Highs and lows in life. Maybe today those lows don't feel too low. Maybe they feel really low. Once you've done that, we're going to start thinking about mapping the way that events and ideas and learning happens over the course of our lives. So what you're going to end up with is something that has different activities, events, and ideas listed across. I'm going to have some words up here to help guide you as you're doing this. So so if you have your line, even if you need to continue the line as you go, we're going to start with adding 3 moments that you think have defined your life. So you can put your birth on there, you can put graduation from high school, you can put a big bad breakup that you had, you can put a big amazing commitment ceremony or wedding that you had, your first child, your first sibling, you published a book. You're published a book. I haven't, so it's not on my lifeline, but it could be. 3 moments that when you give someone your life story, you're like, I've done these 3 things. Can help if you want to keep, you'll know yourself, this is for you, but you can add 1 word. If you want to figure out where it happened, if it happened when you're 18, pick what that is and add 1 word for yourself to remind you what you're writing, because you're going to write several other things on this list. Oh yeah. And as you're finishing that up, we're going to start thinking about another set of moments in your life. So you can continue writing your 3 moments that define your life, 3 events. Next, I'm going to ask you to maybe use a different color or a different shape, and if you need different colors, I can very much bring them to you. And the next one I would like you to do is 3 times you learn something about your body. So that can mean anything about your body. You learned what it meant to have, what it felt like to recover from a fever. You got chicken pox. You, any time you feel like you learn something about how your body works or doesn't work, how your health works or doesn't work. Anyone need new pens?
Right.
Or would like new pens? Yes. Additional pens.
I think we have like literally 2 colors. I sampled them. We had to do our sandwiches real quick.
Yeah, exactly. If you're putting your sandwiches down, pick more pens up. That's ideal. Yep.
Did you ever like create
As an example, and to show that some people said they're feeling vulnerable, something I learned about my body very early is that it is bigger and taller than other people expect women's bodies to be. And I was taught that many times over the course of my childhood. So I learned it multiple times, and I had to unlearn that and learn different things about it. Next line. 3 things. Again, you can write things in a code that only you know, in something that only, in a way that you're comfortable with. 3 moments on this path of your life in which you learned something or you came to understand something about sex or sexuality. Sorry. It's fine, there's happiness and joy when you talk about all of these, hopefully. Sometimes not, that's also fine. These questions all can bring up pretty serious and also joyful things, so. Tools. You look like you guys are ready with those. Some people were ready with those moments about sexuality. And their body. I'm going to finish with the final one. It's totally fine if you need a minute. We'll hold this up at the end as we're talking about it for you to finish, if you want to finish. So finally, look at your lifeline. Agnostic of where everything else is. Place on that path 3 moments when you learned something about abortion. They can be things that you learned early and unlearned. They can be things that you've been gradually learning. But 3 moments in your life plotted against these other events where you learned something about abortion. Doing an activity that people are finishing up. If you want to, you can take your own, but you can also just follow along. Who would like 2 more minutes? As people are finishing up, does everyone have this information here? You find I can move on to the next slide as you finish. Great. I understand the need to really throw yourself into the art of this. So the question I'd like you to, for 1 minute, sit and reflect on yourself is looking at your path as a whole. Now that you zoom back out, now that you've added these events, these inflection points in your path, and start considering 1 or 2 of these questions. When you look at your lifeline, this line about your life, what's one thing you noticed? What's one thing that you noticed, maybe something that happened at the same time, a surprise, something something you really notice about the shape or the pace of the things that have happened in your life around these issues? What's one thing that really surprises you? Notice if you see any connections or something interesting about how close some experiences or learning happened. When you look at it this way, what does this make you think about other people's life experiences? Does it make you feel connected to or isolated from others? Everyone's pretty much done. I'm going to invite you to, if you want to, this is fine, if you would like to sit and continue to reflect, turn to a person near you. And you don't have to share specifically what happened, but share responses to these questions. Anything in particular, it could be as full of or devoid of detail as you want.
I think I'm still in this period of my life.
Also, are you interested in sharing? It's yeah.
She's my sister.
It should have been a little lower, or maybe this part should have been.
A little bit of
Oh, really?
I'm Irish. I've never been
I feel like I would have charted it differently had I known. I think that's a good.
Yeah, so she moved here and
Feel more of that.
I guess I was based on being here, and now she's actually good at substance.
I just think like has
We're from Washington State originally.
that although lots of other people experience
That kind of. She was coming. At some point, she knew she was coming to North Carolina, so that made her good. And she moved here from where? I would still work here.
So I had some things about having for lack of a better word, in my creative area. All the time, maybe do better. So like I feel like it wasn't until I got pregnant and I started asking like a lot of questions. I was like 80 every day. No, I know. I
prescribed it. It's really knowledge that you would in the United States.
It's not one of the ones where it's related to yeah, exactly, yeah.
And it's strange because now a lot of my addiction like medical
my baby should have tweeted. It's cool that nobody told me like me and my baby would be going home in diapers.
I didn't even down.
Exactly.
I did all of
Yes, so
Right, wrap up the next 3 seconds. 30 more seconds.
So it was years where I've been in internal medicine, just general. I'm not. Oh, So you in?
All right, thank you, everyone. As a room that we have, for the most part, we do this activity with people who are members of the network. And even then, at the beginning, it can be kind of quiet. People are quiet and are hesitant. So I want to both appreciate and commend you for being willing to share. And we're very grateful that you're willing to share with each other and really get reflective so early before you even told you what we do. So did anybody hear something interesting, either that this maybe have come from your personal reflection or hear something interesting from your partner? Conversation partner? Something you learned or were surprised by?
My mouth is full, but I think just felt a lot of lack of knowledge and naive in a lot of circumstances, especially in youth. I mean, we're still pretty young, but
So you sort of saw that like you had to do a lot of things without information?
Yeah, like it was completely blank up to like my period. And it was like, wait, what?
And then it was still like, what is this?
And then suddenly there's a lot of things to learn. Yeah,
Yeah.
And things go much more quickly.
Uh-huh.
Yeah. Anybody else? And it's one that this is not bringing any confidence, that's one that we hear like across the world. We have members in 78 countries, and that is not even a little bit surprising, unfortunately. Anybody else? Please.
We had similar experiences in that abortion was something I guess we started to think of more after knowing people who were in a position where they were contemplating the choice, and this is when it became present and more relevant to us when it was personal, when we knew people who had to contemplate.
Yes, when you're like you actually can see sort of what that looks like, what other people's life decisions look like. Yeah.
So someone has actually told you.
Yeah.
Talked about it with you.
Yeah.
That's kind of a crux.
Yeah. It has to do with reducing emergency. Yeah, please.
I would just piggyback off of that because I think that's really interesting because I think that my experience when I first met someone, or not met because it was someone in my family, but when someone I knew like had an abortion, that because I was so young that there were so many things that just weren't explained to me, and then I think because I grew up in a Catholic household, it was kind of like the information I was given on abortions was just that it's bad, don't do it, like don't even think about it, don't talk about it, like X. And so I think it was, you know, like years later until I actually like felt informed about, just in a sense that like I had enough knowledge to be able to be like, this is why I am pro-choice, you know, whereas before I was kind of like, what you're saying doesn't really feel right, but I don't really know why it doesn't, but okay, like I'm gonna follow this because that's what I'm being told as a kid. But so there was almost like this lack of when I first knew someone, and then when I finally was like, oh.
Right, and it sounds like
this makes sense.
It's like misaligned, right? This idea of like you get this information that you have no context for, and there's no way that if you haven't learned any things and people are not teaching you things about your body and sexuality, and you get taught about this thing that doesn't make sense out of that context. Yeah, where do you place that?
Very overwhelming.
Yeah, and it's something that your experience really resonates with mine, also having grown up in a Catholic family, but where justice was talked about separately from abortion. Yeah. And so by the time I got to an age where I was making decisions and thinking about what I wanted to do, I was like, but in every other way, my conscience is what's supposed to be guiding me. Mm-hmm. Why does, in this situation, your ideas about my body dictate that? And it was actually an ideal like that did that. And I just picked that obviously the ideal that you preach overall is the one that you need to pick, but that doesn't mean that I was getting that support from my Lifeline or the things on there. And many of our members often find that they don't feel or experience those things until they encounter someone, until they encounter their own experience. Thank you for sharing this. You can, if you want to, we gather some of these. If you haven't put your name on it or you want to, it's fine if you want to keep it. If you want to gather them and add them to the core of lifelines that we have, that sometimes we connect all around the room, we would love to have that, but also you may keep it. I do it almost every other time I do it, and it looks different every single time. So we look forward to, but feel free to share them with us here. We love them.
So Katie mentioned we do this at almost all gatherings that we have in some way or another, whether it's with health officials from the Ministry of Health or high-level lawyers who are advocating for policy change, or community-based activists who are doing really radical work in the community. We do this, and it typically does unleash some real reflection and a way of connecting with the rest of what we do personally. Because the thing is we're people first when we come to this. We're not public health professionals or communications professionals. We're people first when we come to this. The stigma that's attached to abortion is attached deep inside. So we start with that. But I am going to go a little bit into kind of the nuts and bolts of Inroads as a network. Why a network? What do we do? How do we do what we do? Whether or not you can join. Let me just say the answer is yes. So just kind of a high-level timeline. Inroads was cultivated out of some work that IPAS, which is an international non-governmental organization down the road in Chapel Hill, and others in the field were doing to really start looking at stigma as this this barrier that stops us from doing our work when we're talking about expanding access to safe abortion, when we're talking about law changes, when we're talking about promoting access to contraception. What is it that keeps stopping us no matter how well we've designed our programs, how well we've evaluated them? And stigma is what comes up. So they started really talking about it and thinking, but this is something that manifests all over the world. It's specific. It's constant that it happens all over the world, but it can be very culturally specific. So it's no use if the experts at IPASS, at UNC, at Duke, at Answer, at UCSF decide what's best. It really needs to be living and driven by the people who are encountering stigma. So let's fundraise and launch a network and hire some people named Katie to run it, which is what happened. And we have a global steering committee. We have launched granting mechanisms, so members have access to grants. We have launched an online workspace where people have a listserv and a place to share draft documents. We have lots and lots of gatherings that we'll share some highlights from. And now we have an even more reflective steering committee, and we've been partnering in new ways with other organizations and entities in the field that I think is really driving this work forward in what we think is a movement building way, as a collective, that the broader sexual health and reproductive rights, the broader reproductive justice, the broader abortion rights community can start thinking about, as we're dismantling stigma, if we do that powerfully by overturning and upending oppressive hierarchies from a very feminist place, we can do our work better. So this is us. We are Inroads. We haven't said anything other than Inroads very much, but we are right now hosted at IPASS down the road, which is fantastic. They provide some operational support to us, a couple of key staff to help us do all of this, because there's 2 of us convening this network. And we have this amazing global steering committee. And so we have people who are doing radical outside of the health system work, bringing misoprostol to people around the world and running websites that are now available in the US because we need them. We have an artist from Ireland who's using art to really shape how people can experience their reactions in their bodies in a more visceral way and transform what they think and experience. We have a badass community activist and program director from an organization in California. We've got us, a woman who runs a hotline in Kenya that provides real information on how to take safe abortion medicines, a director of a clinic in Mexico that provides first and second trimester abortion services, and somebody who runs an advocacy network in the Philippines advocating for safe abortion, which is one of the most restricted places in the world. And a researcher from IPASS who is fantastic. I think I've covered it.
And the one person we're missing is a staff member at the International Planned Parenthood Federation,
yes,
who works with youth and abortion stigma.
Yeah. And we look kind of fun here, but this is really what we usually look like when we're working. Because this is hard work, but it's really transformational work. This is the network. We've got 78 countries, 865 members, and I just checked about the open member requests. It's going to go up to 875 pretty quickly. So people join as individuals. They don't join as, I am the representative from Planned Parenthood, or I am the representative from this community-based organization. People join as individuals because we interact with stigma in the world as humans and individuals first. So we did not want this to be a consortium where powerful organizations designate a staff person to do this. That's not how we think we're going to transform stigma. We're going to transform it by bringing people together who don't often get together. So that is our network. We have a few more countries to add, but yeah. We're trying to spread the red, orange, and yellow.
How do you get people involved? Like, how are people in other countries aware of this, that they can do this?
There's a lot of word of mouth.
Okay.
And we host gatherings and make it available that people can join. So
almost everything that's going to come after this, we're gonna give you some answers to the questions.
Yeah. But what is membership? Because people do get confused working in professional settings, used to working groups or consortiums. You basically have to just personally be committed to the advancement of sexual and reproductive health and rights, specifically including not separating the right to abortion, and understand that stigma contributes to the social, the legal, and the medical marginalization. Somebody asked earlier if there's abortion training at Duke Med School. Do you know?
Yes.
Yeah?
Yeah.
There is?
Yeah.
Okay. Some places that's not true.
Many places.
Many places that's not true. Yeah. Some entire countries it's not true. So they endorse this. They give us a little bit more information so we can make sure they're not a infiltrating anti-choice person. And they can join. And so there's some benefits that we really try to set up, such as being part of a broad, diverse community of practice, having opportunities to actually highlight and share your work, applying for support to go to places that you couldn't otherwise afford to go. We're about to support probably 10 or so individuals to go to a big conference in Vietnam who wouldn't be able to go otherwise. So, these are some members at our inaugural global member gathering. And we did a year 1 or 2 evaluation of how we're doing as a network, and found that we've really, I think, done a good job establishing this community of practice. People are getting real value. For example, one of the members shared that the focus on stigma is much more clear now. In the past, we didn't really talk about it. We just talked about comprehensive abortion care, but we didn't really think about stigma, and that's transformed our work. And then people really value even people who only interact on the listserv. So don't come to a meeting, don't attend a webinar, just interact on the listserv, have expressed that they found value in the tools, resources, and just knowing other people around the world are doing this work. And that sense of solidarity, it was kind of a deeply implicit goal of the network as we launched it, but it wasn't, in the logic model. But we found in findings from our in-person meeting evaluations and from the big evaluation that it was one of the most profoundly changing benefits of membership, that people felt less alone. That somebody who's doing her work in rural Mississippi felt less alone. That somebody who's doing his work in Sierra Leone felt less alone and felt stronger to do this work. So we wanted to give kind of a focus of what Inroads members do, just like a highlight. So this is a little bit of a highlight reel, but you have a look on your face, so I want to see if you want to add something.
I do, I want to add something, because it responds to the question you have. I was a member before I joined, and so the idea that Inroads create solidarity is something that was not an accident or something that I was surprised by when I joined. And so the way that members, so what do members, Inroads members do, we're going to see some of the very specifics, but one of the ways that people get connected to us is, there's a couple ways. One is we'll see the work they're doing on social media, or we'll see the work, the collaborations that they do with other people. So that's different for different groups, but like if we're working with an activist, we'll see an amazing artist that will turn up to that. So we're working with a march, and we'll see an amazing artist that's like, that poster, that idea, like really captures this really well. We work with them and get engaged with them to pull them in. Same thing with if we find out that a Med Students for Choice group is working in Rwanda to do education, and we find out that there's a midwives group that turned up and came and did the training as well, then they join afterwards. So it's a snowball effect. And so all of these things that we're talking about here tend to, after every event, right before every event, we have a little influx.
We do.
Yeah.
And it's true that when it first launched, it was everybody who's on a typical abortion listserv. That's who joined. Then they said, wait, you should join. No, you should join. And now we're getting people who are like, I'm working on stigma in my life. I need this. Mm-hmm. So what are members doing? So we have members who are doing research, who are designing scales to measure stigma and adapting them, who are evaluating interventions to see if they actually work to reduce stigma. We have members who are basically developing tools, curriculum, and adapting them, and programmatic interventions. And we have members who are doing really awesome art interventions, resistance strategies based in art. And then we have members who are basically connecting with each other in an interest of mutual support and learning. And so mutual support and co-mentorship is kind of two themes that we hit over and over and over again in terms of how we operate as a network. So here's some examples. These are some grantees that we have. So Women for a Change in Cameroon is a seed grantee. Actually, I would like you actually provided technical assistance to them as they developed their video.
So Women for a Change Cameroon is this really interesting, very small group that had been working until recently on mostly sort of feminist, they would work with international regulating bodies like the UN, like work at the UN, like bring their ideas, to the Cameroonian government, bring them up. And then they started looking at the way, they saw the way that abortion, the lack of access to abortion for young women, especially young women in Cameroon, was affecting the people they work with and the youth that they serve. They reached out to us. There's a couple other people that have been working in Cameroon and had heard about the network and really wanted to make a video that could more easily spread the idea of like how stigma works and how it works on us and what we need to do, the reason that we need to end it. And so we worked with them. They were in a large city in Cameroon, and we worked with them to connect them with ideas for how to use visual culture to share real stories that women experience. So one of the stories in this film is about a woman who's 40 and has 3 children she needs to take care of and has neither the resources, the time, or the health to take care of a 4th pregnancy. Another is about a young woman who is not ready to have a child, and another is a woman who is not healthy enough to carry a pregnancy to term. And they worked really closely with other members to make this video. It's very short, and it has been now shown to the entire Ministry of Health for Cameroon and the majority of their non-health ministers, as well as moving on from that. So yeah. You can watch the video on our website.
The YPG Foundation is based in India. It's a youth-run group, and they do participatory programming and research, and they did this mixed method mapping where they were trying to map where health services are provided, where abortion services are provided. Are they youth-friendly? Do they not stigmatize and marginalize young people in the way they develop services?
All services, so for accessing contraception and making sure that abortion is included in that.
Yeah. BeyondBeijing Committee in Nepal came to this work as a general, broader human rights organization, grounded in feminism. Nepal is a place where abortion is legal. It's very, very enabling a legal environment, and their most recent success is that abortion is now free in the public health system. But they started looking at community level stigma and found, wow, it's still really, really severe. It's a real barrier. Women don't even know that it's free, that it's legal, and nor do they know what are some of the other methods they can use outside of the health system that will effectively end their pregnancy. So they did some participatory focus groups and measured that stigma and are now developing interventions to transform the community level stigma.
Yeah. And the way that works, this idea that like complete legal access, it's a similar thing that's happening in South Africa. Like complete legal access, actually free access, being prevented by stigma, meaning like just the lack of information and silence, preventing that. The same thing happens in other countries where doctors, providers don't realize that they actually have the right to provide abortions or to provide a type of abortion, like a later term or an abortion for a person who's requesting it, meaning that they end up enforcing a law that isn't real and bringing law into their health practice to keep themselves safe. They think they're keeping themselves safe. What they're actually doing is putting themselves at risk and putting their patients at risk as well.
And then Equidad de Género in Mexico is doing an intervention, and they actually got a grant to evaluate the impact of that intervention. And these are basically talking circles with indigenous women to really talk about their abortion experience. And so they're measuring the impact of those circles on individual level abortion stigma. And so a little bit about how we do what we do. We have 4 strategic pillars in what we do as conveners in terms of supporting the network. We gather and connect members in ways that you've seen in some of the examples. We really work to center abortion stigma as a concept, both with the sexual and reproductive health community, but also in other places. So working with disability rights activists, working with contraceptive providers, working with gender-based violence work, thinking about stigma as a lens to transform how you do your work. We catalyze and support capacity strengthening, and we very clearly don't say we do the capacity strengthening because we are 2 people. So what we do is we develop systems so that people can strengthen one another's capacity. And we facilitate the generation and application of evidence. Same thing, we're not the research team. I mean, I've done research before, but that's not what we are doing. But what we're doing is we're facilitating it so that our members who are doing that research can get those findings out and diffused into the broad global community as quickly as possible. What are the practice recommendations? What can we do? How can we adapt? What have we learned? And give that feedback right on back to those researchers.
And that's important. Those last 2 points are very important because the idea, and as Katie touched on, there's just 2 of us. There's also just an amazing wealth of experience and expertise in the network. And that's something that is, Katie talked at the beginning, the idea here was that this was a network that wasn't going to just be run by several large organizations that were the experts with a capital E, that we really focus, and this is something that I imagine, like when we open up for questions and talk about that there's expertise in every person in every member of our network, expertise in terms of how stigma has affected them in their specific context, and how they can work well to adapt some of the tools we have, to use the research for how to look at abortion stigma in the health system and try to use it in a clinic setting as opposed to a large hospital, really to bring that expertise and value that expertise, because it's amazing how when you bring a group of people together, power dynamics end up meaning that people with deep expertise stay silent, and so that's something that we work on we have to use all of these tools to make sure that the expertise that really does exist in every one of the 875 heads and bodies of our network get to proliferate out. Yeah.
So this is some of the ways we gather folks. We've done, I haven't counted all the events. How are we at number of events?
There are 12 that we've hosted ourselves, that we've done ourselves, yeah.
And probably 10 or so that we've sent people to and done side meetings at. This is a scene from our inaugural global member gathering, and we have community activists from Zambia, an entrepreneurial human rights activist from Pakistan, and a human rights director of a pretty well-established organization from Nepal, working together, connecting each other's experiences. This was from a meeting very recently in Zambia. These are actually two people who are from Kenya, but they didn't know each other. And now they have connected in a way that they did not know each other at all before. They came together at this meeting in Kenya and now have new ways of collaborating. We do things online, online sessions that can be bring your own question webinars that are very open to our members to drive the conversation. Katie usually starts it with a topic that's been drawing attention on the listserv, and then people bring their expertise and their questions in a webinar setting, which is pretty transformative because usually webinars are presentation driven.
Yeah, people at first were like, wait, so when are you going to tell us these things? He's like, no, you're going to tell us these things. Yeah. So what's an example would be someone gets on the call and is like, I'm actually looking for, I need to have better language. I'm about to do this research about people's experiences in the clinic, and there's just no language, there's no positive language. Can you help me rewrite or help me think of some interesting metrics that actually look at people's positive experiences? And then the other 20 people on the call think it through and give their answers right there and follow up later. So it's a little mini workshop every other month with our members who are really trying to do this work and integrate this work into their programs.
And then we do webinars that are more centering what members do. So for example, the Abortion Care Network did a session on designing anti-stigma projects, like applying the traditional public health project design approach to anti-stigma projects, and that was also very powerful. If you ever have questions about these illustrations, we have an amazing graphic harvester who works with us, and she has a side business, so I can give you that information. We go to other conferences and have events and kind of transform the way they do their conferences sometimes. You want to say just a few about Belfast?
Yeah, the way we think about doing events at other people's conferences, we tend to bring our members together on the day prior to an event. And so something that you may have experienced as healthcare workers, as activists, as people are interested in this topic, if you go to a big meeting, you will notice that abortion is either not mentioned in the program. You have to fit it in wherever you can, or it is all put at the same time, so you're competing for slots and all attention of the people who want to go to that. And there's ways that people get marginalized even at these professional events. And so one of the things that we really work to do is in the day or two prior, we gather as many of our members as we can. We support many of them to come. And we have a very targeted, topically specific or regionally specific meeting that covers issues that we know are important to us, the 15 or 16 of us that are in the room, that are important to our broader network, and that we think as a group need to be brought to that larger space. And so this is the meeting that happened in Belfast last year. It's called Abortion, Stigma and Reproductive Justice, an Unfinished Revolution, and it is. The first one happened in Canada, the second one happened in Belfast last June, and the third one is happening in South Africa this next summer. Something to think about for everyone in this room and beyond. But the idea is that we knew we were going to be there is that this was a group of people in Europe who were using the ideas around reproductive justice. Reproductive justice started in the US, started with movements of women of color in the US, and the idea of reproductive justice was missing some of those core concepts and those ideas of oppression that really started here. So we wanted to bring together a group of people that were global, that from a global area, to talk about what it means to do reproductive justice in non-US settings and in really different political climates, because it doesn't transfer like perfectly. And so here you're seeing a map of, we use the UN ideas of, we look at human rights that most of the countries in the world have signed, and looked at the ways that different stigmatizing experiences, we could use these human rights, which you can see at the top, all the very specific human rights, like a person's right to life, a person's right to health, freedom from cruel and degrading treatment, and how we can use those ideals to address stigma either in our workplaces and appeal to those human rights, those principles, or to actually take specific cases to human rights bodies or to international criminal courts and courts.
We also do webinar series. So we partnered with Women's Global Network for Reproductive Rights leading up to the most recent September 28th. September 28th is a global day of action for access to safe and legal abortion that was started in Latin America by Latin American feminist groups. And 6-ish years ago, maybe, Women's Global Network for Reproductive Rights took that movement global. So now it's a global day of action. So leading up to it, we collaborated with them to host a resistance webinar series where we talked about holistic security, because we're talking with people who are doing really interesting work in places where criminalization and appetite for prosecution is increasing. That's true here. And doing this work online means we're vulnerable. So let's talk about what security means on a personal, on a physical, on a digital level. So we brought speakers together. We had another session on self-care and collective care. We're in a movement where we're working really hard. A lot of us are volunteers. Some of us have it as our job, but we're all doing very hard work that sometimes, when we try to describe it in our personal life, it doesn't go so well. But what can we do for self and collective care? Taking care of ourselves, taking care of each other, so we can show up and do this work. The third illustration is not complete, but it is actually strategies of resistance in different settings, and we featured speakers from Uruguay, from the Philippines, and from Ireland to talk about different strategies for resistance. And those were very powerful sessions for resisting and persisting in honor of September 28th. And we have the Nwords Partnership Fund, which is a small granting mechanism. So members, any member, is eligible to apply for the different grants that we have. So we have a portfolio of maybe 12 past and current big grants. When we say big, it's about $25,000 US. It goes a long way in a lot of places. And then a portfolio of 30 to 40 plus seed grants. So $3,000 for a smaller short-term project. But again, they surprise us with what they can do with what seems like limited resources.
And the seed grants are a special project. It's something for you all to think about as well. They're projects that do one of three things. Either it's a tool, creating a tool that is documenting something you've already done. The second thing is a translation. So if you found this amazing tool, this amazing scale that measures how stigma works in the clinic setting, and it's not available in Swahili, we will give you the money to translate it into Swahili. It doesn't have to be Swahili, but any local language that you want to have it in. And then the third is an arts activism or arts-based intervention. And we specifically call that out because there's something that happens, and you all in this program and in this building may know about this, that there's a last-minute addition of pretty things always happens in health and in large organizations, and artists get asked the last minute to add or to donate their time when no one else is getting asked the last minute and donating their time. And there's actually more overlap with arts and medicine and arts and activism than we think, and so we really work to have artists be part of the beginning and making plans and doing the design work and not just coloring in at the end.
And we do produce some tools. These are in Spanish. We did a qualitative synthesis of findings about abortion stigma in the literature that we made available to members. It's downloadable on our website. And then we also did, based on an online discussion list with specific discussion questions about stigma and quality of care, we integrated concepts of stigma with the WHO framework for quality of care and started looking at what could be indicators of non-stigmatizing services at each of those WHO levels of quality of care. And members are using this to kind of start assessing the health service quality. We also have an online compendium of resources and tools that Katie's worked really hard to do the design and information architecture. And there's 3 kind of curated lists that we've put together, and we'll continue to do that as different topics come up. So measuring stigma, centering people's experiences, and then stigma theory in general. And then you can also search for any of the resources and tools just straight up using faceted search on the website.
So we have as Katie mentioned before, we have a private space for members only where you can share things that are more in progress or aren't ready for public consumption. But this is a space that really does document, and we add very regularly. So I think we're up to 255 now. Resources. Yeah. Come back.
Another backlog.
And I'll put on the website.
Yeah. So, I need this for this one. Okay. Inroads, as a network, as a collective, as a movement builder, we have a big vision for why we're doing this. And it covers a lot of areas. And so our primary goals, we're really committed to a world where abortion is understood as a common and necessary occurrence. Abortions are not isolated from family planning and contraceptive services. People who need abortion have access to it where they need it, how they need it, when they need it, and at a price they can pay or free. Abortion is integrated into pre-service and in-service training. It's an integral part of comprehensive and reproductive rights. Laws do not differentiate between who can have an abortion and who can't. Anybody can have the abortion that they need. The laws support all individuals' rights and needs. Abortion is a common part of media discourse and is supported by positive imagery and language. And that community-based organizations can and do advocate for and address abortion service access without jeopardizing their local community partnerships, without jeopardizing their other funding, say from the US federal government, and don't jeopardize the funding or support of their other SRHR efforts, because frequently community-based organizations have this hard, like if I do this advocacy for abortion access, that means that I can't do what I need to do on family planning. If I do this, if I get my USAID supported family planning big contract, then if I get caught talking about abortion, then that jeopardizes that funding. And we're working for a world where that's not true. And you can join.
Does anyone have any questions for us about the network, about how stigma works, how it turns into discrimination? I would do it. Yeah, please.
My question is about stigma and how it works. And I'm wondering, do you ever find an issue or how you deal with the fact that, you do such good work and research have done great work in showing how awful stigma can be on individual women and in the broader healthcare context. But sometimes I'm concerned that, if you emphasize the stigma, then you're also getting into this framework where abortion is getting caught up as a negative thing, and it also seems like you want to move away from that, and it's something that I'm concerned about in my own work. I'm a PhD student in the law school, and it's just how to have that balance, because you said there are positive experiences. Women experience relief and solidarity, and also stigma, but sometimes we only hear the bad part.
Yeah. First of all, I think we met at a meeting in Dublin.
We did.
We did, yes. Yeah, that's great. It's nice to see you again. The community always gets a little bit bigger, but it still remains quite small, and it's very nice. It's very nice. It's a good question, and it's one that we think about a lot, because we spend a lot of time, especially interacting and working with people in the healthcare setting, in the legal setting, and those focus, the focus often can be to prevent something from happening, to mitigate something. The words, even in, so you can see our URL is end. It starts with the end. We want to end abortion stigma, but it's not. We can end up having a focus that feels more negative or more resistant, right? It's like we're looking at resistance. But the idea that that I think that we really work on. There's sort of two ways we think about this. There's many ways, but there's two ways that we can kind of address this sort of negativity first problem. And the one that I think of first is that the actual negativity first is something that we can do something about. There are many scales or interview tools that people use that assume that stigma or negative experiences are all people have associated with that. So we have a member named Ibis Reproductive Health that worked really hard with us, and we've been talking as a network of how do we introduce the positive that we know, the experiences that we know have into those tools, into those intake and outtake forms in which people are trying to measure stigma. How do we, when we measure stigma, not assume a certain level of stigma? How do we also measure the positive sentiments that we know people have? The relief, the freedom, the feeling of justice, the true joy that it comes from getting the service that you need. And those are things that we have to read the documents. So one of the ways that we do that is we get requests all the time to look at our members, or sort of like International Planned Parenthood Federation member associations will share with us the documents they have, or share with their members, and we'll read it and say, you actually don't need to use this word here. You don't need to say safe abortion, that's stigmatizing here. You're talking about abortion, you're talking about the right to abortion. And the right doesn't, the right is, abortion is safe as a definition. We don't talk about unsafe dentistry. When we're talking about abortion, that's what we're talking about. And so let's find ways that we can get rid of that language. The other thing that is, I think, pretty powerful about the question you're asking is that everyone is experiencing the negative effect. There's a quote from a member of the network, which is that stigma it's like rain, it gets on all of us. And there's something that happens when we are experiencing something negative and all just staying silent about it. One of the things that happens is that stigma becomes a calcified part of our communities, that we have a really hard time pushing against, and it gets harder and harder to talk about it. So having the risk of saying, this was more painful because I didn't get the pain management that I needed. I was denied the pain management. This was more painful because I had to travel for a day or travel for 2 days. This is more painful because I had to somehow scrape up the money to get my children taken care of when I traveled across state lines. There's a number of ways in which saying those things out loud to the people that is experienced actually releases the negative part that they felt like they had to hold in their bodies and on their own.
We can actually all see together that it's raining, so here's my umbrella.
Yeah. And so if you're talking about the stigma and also talking about how you're breaking it and being realistic about how it's hard to break, it's a way to reframe. And so, but we do 100% agree that if you're only talking about negative things and only saying the word unsafe or safe next to it, there's a sense that you're sort of giving up ground and saying that abortion is unsafe, or that at its core it's not healthcare. And so I think it's, depending on where you are, it's a really